A study by the Centers for Disease Control and Prevention states that excessive alcohol consumption increases aggression and may increase the risk of physically assaulting another person. Alcohol is a key risk factor for the commission of sexual assault. Males are more than 3 times more likely than females to commit suicide, and they are more likely to have been drinking prior to suicide. We are now joined by clinical psychologist Emerita Malanguka as she informs us about the impact of alcohol on men's mental health. Good morning, Emerita. Thank you so much for being here this morning.
Hi, Elago. How are you?
I'm doing very well. Thank you so much for asking. How are you doing this morning?
I'm great. I'm really passionate about the topic this morning. And I love the follow through this morning as well. We had Kelau earlier speaking about self-destructive behaviors. And she mentioned alcohol as a critical self-destructive behavior. We had Teresia on, and she was speaking about the linkages between alcohol and schizophrenia. And how cool is it that we get to slot into this segment now. And I think when we talk about men right now, I just want to really clarify, we're not talking about the biological basis of the disease around alcohol addiction or alcohol use disorders. We are speaking about the gender, the social roles around it, and how that impacts men's mental health. Because when you ingest alcohol, whether you're a man or a woman, the impact on a biological level is quite similar. It's not the same, but it's quite similar. We can draw conclusions from similar samples. However, when you look at the social role of a man and the social role of a woman, and what we see in private practice as psychologists and psychiatrists, the presenting problem is what your patient walks through the door with. That's what you call your presenting problem. And we find that men, more than women, would present with a substance abuse issue as opposed to women being higher on the mood disorder side. And so that begs the question, what is the mental health effect and what is the impact? And I would say from a gender role perspective, the biggest impact for me as a clinician is its numbing and deterrent to care impact. So I would not want to talk too much this morning about things that we know, delayed response, poor judgment, its impact, and we will unpack that a little later on comorbidities. But it's just the focus that the consumption of alcohol delays care for men, both on a physical health perspective and a mental health perspective. It delays care and it blurs the symptoms. It hides the pain. It hides what's really happening within the person, and that means the person would not be able to step up and not necessarily come to us, but reach out to anybody nearby who would be able to assist them. So I'd say the biggest impact on men, when you look at society and you look at what we're struggling with right now, is that it delays their health-seeking behaviors. And health-seeking behavior is that critical item that influences your choices and decisions around seeking care for yourself.
All right. Now, when you let's go deeper into the impacts then of alcohol on men's mental health.
It masks depression. It masks anxiety. You just very clearly said that most men, prior to committing suicide, there's some pattern of alcohol abuse or drug abuse or some form of addiction. So, and that's what I said, that's the biggest barrier. It masks all the other mental and physical illnesses that are sort of sitting beneath the surface. It masks anger. It masks frustration. It masks painful needs that we need to process, difficult emotions that we sometimes struggle with. What we call alcohol is a social lubricant, and it's a great way to get past a bad week, isn't it? After a really tough week, after a really bad day, what's your usual go-to? And it's accessible everywhere. It's right around the corner for most people. So instead of dealing with the emotion, instead of addressing the issue, learning to process, there's something called emotional maturity, right? And as we grow up, if you look at a child, you look at a baby, children come into a world and they are bombarded with lots of sensory information, things on the inside and things on the outside that they need to learn to figure out. And that's the critical part. We watch children grow and we watch them learn how to regulate, self-regulation, how to take care of themselves and how to respond to the world on the outside. But this is a process that doesn't end when you're 10, 15, 18, 28. It's a lifelong learning process. That's emotional maturity. And that's why you find a lot of people talking about EQ training, emotional intelligence and stuff like that. It's a lifelong learning. We need to, as we cope with life's challenges, learn to process those difficult emotions, learn to cope positive strategies to cope in difficult situations. What happens instead is, with the numbing and the deterring effect of alcohol, it creates the short-term effect of, I'm relaxed now, I'm happy now, it's okay now.
Yeah,
and
but
so
then
what we're doing,
the question might be for somebody who's watching this morning and uses that as a way to numb, is what is the alternative then? How do I cope? Because it's easier said than done.
address the challenge.
How?
Sit with it.
In which way?
Emotions are painful, the tough ones. I mean, joy is great, we accept it. Happiness is fantastic. But sadness, anger, disappointment, heartbreak, rejection, painful emotions, we sit with them, we talk it out, we get support, we look at what the problem really is. A simple emotion like anger, we see anger everywhere in different colors, shapes and forms, but anger is a surface emotion. There's always 2, 3, 4 things underneath that we need to work through. What was the need that was unmet? What is the pain that has actually come out of this, and what can I learn from this? How can I grow from here? How can I, in a healthy way, process it? Please note, processing in this way is not easy. Alcohol is your go-to because it's easy, it's pleasant, it's short-term, it has a wash-away effect, but you're not really dealing with what happened.
Yeah, we unfortunately do not have enough time for our conversation, but to get to solutions, you know, you mentioned addressing the problem, sitting with the problem, or sitting with the emotion that causes the problem, but how can this be then treated medically?
And that's where we come in. That's what we do. That's what we're trained to do. We're trained to walk the road with you. We're trained to support you, give you the tools, teach you healthy ways to cope, teach you and your support system. We don't just work with individuals. We work in groups. We work with families. We work with people across the ages, from young children, helping them process, all the way to your geriatric population, which is plus 80 and so forth. So there's never a time that we stop learning about ourselves or stop learning new ways to improve ourselves as human beings. So get the help you need. That's the long and the short of it.
What role then can we as society, or me as a mother, as a daughter of somebody who, or a man who's struggling with alcohol abuse, what role can I play to help them?
I think the first thing is, I always see the biggest barriers to care, and the biggest barriers specifically for men are either misinformation or denial. I think not either, both. Misinformation, miseducation, and denial. When you think about an alcoholic, there's a specific image you think of. It's a specific socioeconomic status, a person must look a certain way. Alcoholism hides. It's the greatest pretender. It hides under the most well-dressed, well put together, beautiful life type of person.
But then when I am aware of their addiction, what do I do as a family member? How do I assist them?
Well, you start by having a conversation, bringing the symptoms to them. The symptoms are available everywhere. What alcohol addiction looks like. What is a binge drinking alcoholic pattern? What is a continuous, the usual 1 or 2 glasses, but every day, but you've lost control and you can no longer say no. That in itself is a pattern. You notice the symptoms, you have a conversation. It's a loving conversation. You don't go in there and attack and blame and point fingers. That usually doesn't help. You go in with a sense of accepting that you will get a no. Because you usually start with a no. The person will tell you outright, I don't have a problem, I'm sorted.
After the conversation, when it doesn't work, what's the next step?
Get to a professional. You call in a professional. You got social workers, you got psychologists, you got community health workers, you've got GPs and nurses. All these people are trained and aware of what the symptoms would be, and would be a great point of call for you to go as a next step.
All right. Thank you so much for being here.
Thanks.
All right. Well, that was Emerita Malanguka, and she was talking to us about alcohol and its effects on men's mental health.